the reason why I want to talk to you today was we saw the State Hospital Association study on the nursing shortage, and we just want to know, how is that affecting you guys at Providence?
Providence, we're not unlike any other healthcare organization throughout our entire nation. There's really a workforce and staffing crisis at all levels of talent. And as you know, it's been really scarce in healthcare for 10 years, and honestly, it's just getting worse. And this pandemic is really making the worst shortage of healthcare workers we've ever seen.
All right, and one thing that we noticed in the study is it looks like schools they're taking as many students as they can, but there's just so many applicants. How is I guess affecting you guys, or what are some solutions that you've been working with them to try to help up the number of students they can take on?
Actually, I'm engaged with the Spokane Workforce Board, so I'm a member of the board, and we have regular conversations with our academic partners, because you're right, there is capacity issues at our academic institutions. So Providence is a partner to look at innovative solutions for class capacity. We've brought on different programs as well. So we work with the local schools, particularly, well, do you want to stay focused on nursing?
Yeah, we're focused on the nursing shortage, but I mean, if you want to
Okay.
talk about other positions, go ahead.
Yeah, but like particularly for nursing, to respond to just the lower numbers, we brought on internal programs to help with that. We have a really robust nurse tech program where student nurses can be placed in our hospitals, after a period of time in their academic program to work as nurse techs. So that's been helping us quite a bit. And we've done for kind of in that same nursing bucket, we have an internal training program for nursing assistants as well. And then we're doing lots of other creative kind of earn while you learn type programs for other healthcare professionals too.
And then one thing that Wazoo Nursing told me is that one resource that they're short on top of faculty is those clinical opportunities. Is
Yeah.
Providence looking at expanding that here in Spokane to kind of help out with that part of the issue?
And honestly, it's a vicious circle, right? Because with nursing shortages, there's not enough preceptors available. And so until there's more nurses in the units, then there's not an opportunity to expand our clinical sites. But we look at that on a annual or quarterly basis, and we max out the best we can to be able to place those students, because they're our pipeline, right? So we work really closely with our schools and our professional development team.
And then you touched on it a little bit already, that the pandemic kind of worsened an already worsening staffing crisis. I guess, could you just go more in depth on that? What you've seen at Providence with, we've heard about burnout and people retiring early or going into smaller practices. What have you guys seen at Providence?
Overall, like from a national perspective, just so I can kind of put it into perspective, healthcare is really only filling about 43% of their job openings, and Providence. So then bringing into Providence, right now, we're seeing about 25% less applicants than we did in 2019. We're filling about, just slightly, seeing about 40% as well of our jobs are open, for an extended period of time. So just doing all kinds of creative incentives to try to enhance our talent pipeline, like sign-on bonuses, at multiple levels. We are doing retention or recognition bonuses for our current employees. We have a tremendous amount of internal resources for resiliency for our employees. We call them caregivers for our employees. All kinds of things like behavioral health concierge services, 24 hours a day, 7 days a week. We brought on an on-site mental health counselor as well for our employees. Just since this pandemic has launched, that's been really helpful for just-in-time needs. And just doing everything that we can from a stress and burnout perspective to support our caregivers that are at the bedside.
And then when you do see some of those healthcare workers leave either Providence or the industry as a whole, what are some reasons you're hearing from them about why they're making that decision to take a different step in their career?
Our nation's really experiencing the great resignation, and we're not unlike that, right? Providence is seeing higher turnover numbers that we don't like to see, but it's higher than we ever have in the past. And I think people have a choice right now. It's a critical point in our time right now throughout our nation where it's really an employee's market, not an employer. So we have nurses that are leaving to take travel assignments, for example, because it's pretty lucrative. And that's a choice that they have. And so what we're doing to combat that is really to focus on culture and reasons to stay and retention initiatives at our hospitals.
And then you said this was kind of an issue that was started before the pandemic and the pandemic worsened it. Do you guys have a timeline on when you think this might start to turn around in the industry and at Providence where you're filling more of those jobs and those numbers of open spots kind of starts declining?
Boy, that is the magic question, right? And from an HR perspective, I get asked that quite frequently. And I wish I had the crystal ball to know. But honestly, I think we're really in it for the long haul. This is a long game. It's going to be a marathon until we get out of what we're calling the staffing crisis. So what we've been really working with our leadership teams and our external partners is really looking probably like for a 2-year strategy, because just like what you mentioned earlier, I mean, it's not just the supply, but it's also the ability to bring individuals into those training programs, right? So there's so many complexities. So the more, we need more students to matriculate in order to fill the talent pipeline, right? So there's a lot of hands on deck, but probably 2 years.
Perfect. And let's say I'm an undergrad, maybe studying pre-med. What would you say to me to convince me to go into nursing or whatever field it is and to stick with it right now?
Great question, because that's really what our charge is right now, is to engage the hearts and the minds of our young adults, right, at really early levels, not just juniors and seniors in high school, but we're getting into the schools much earlier. And the message that we're sharing, kind of twofold. One, it's definitely hard work. It's, you have to have compassion and to be in healthcare. And it's incredibly rewarding. There's so many opportunities, what we're finding, and this isn't abnormal, but what we're finding is a lot of individuals don't even know all the different types of jobs that are in the healthcare industry. They know nurse, they know doctor, they probably know therapist, but all those assistant type roles and tech roles, there's enormous amount of opportunities, and there's growth paths as well. So once an individual comes into Providence, we support them through all kinds of different opportunities, scholarship opportunities, internal training programs, tuition reimbursement, et cetera. So you can be a lifelong learner in a healthcare system.
And I know I've kind of focused on the nursing aspect for my story today, but I guess what are some other areas of the healthcare industry that you're seeing these staffing shortages? Is it everywhere, or are there some positions that are getting hit harder than others?
Yeah, well, there's really a staffing crisis at all levels of talent, but there are some that are probably being hit a little bit harder. And this is consistent with, I chat with my peers regularly. We're seeing respiratory therapy, phlebotomy, surgical tech, nursing assistants, and RNs are probably our top 5.
So
Medical assistants, I should probably throw medical assistants in there as well.
So this isn't just limited to nursing then, or one?
Not at all. No, not at all. Really top to bottom.
And then you touched on this a little bit earlier, but just to go a little more in depth, when you do meet with, let's say, educational partners in this case, what are they telling you, or what are they asking from you guys?
A lot of it has to do with placement, right? So we get asked that quite a bit. And just to be a collaborative partner, we do a lot of work together as we're trying to engage the next wave of talent, right? So that's what we're hearing from our academic partners too, is how can they walk alongside us together as business and educational partner, having that academic and business partnership as we're looking at talent responses. So that's what we're being asked for quite a bit. And then to come up with creative solutions. So meet regularly with, the WSUs, EWU, Gonzagas of the world, community colleges, and even our K through 12 partners.
All right, that might feel a little short, but you kind of hit everything I wanted to touch on. Is there anything else that you're seeing with the staffing crisis, or when it comes to nurses in particular, that I didn't ask about, or that people might not know about, or might be behind the crisis?
There's probably not a whole lot more, but I just want to say how proud I am of the way that Providence is really strategically looking at the big picture, right? That we're in it for the long haul. We're training young adults right out of high school to become healthcare professionals, and that they can really grow professionally with us. And so I think that that's the thing that I would like to probably share forward is just the enormous amount of opportunities to just step into into the healthcare system where you may not have even considered healthcare as a pathway. And then just the amount of support that we do for the long game.